Chapter 1. About subcutaneous venous ports. Portacath, subcutaneous port, venous access port, and implantable port are all names for the port that make it easier for patients to get infusions, injections, and have blood samples taken. In this instruction video, the ports are called SVP. An SVP is a small metal chamber with a silicone membrane that gives you direct connection with the venous system. It's a good tool for patients who require long-term parenteral drug or fluid therapy. There are many different types of SVPs. They are of different shapes, sizes, and materials. There are single ports and double ports. The needles in the SVP are called Huber or non-coring needles. There are different kinds of non-coring needles: straight, angled, with and without wings, and with and without an extension tube. It's important that you only use non-coring needles. Other needles can damage the septum so it leaks, which makes it necessary to remove the SVP. This picture shows the different parts of an SVP with an inserted needle. The SVP consists of a box with a chamber, a membrane, and a connecting catheter. In this picture, you can see the SVP inserted just under the skin on the chest. The line leads subcutaneously from the port chamber to a vein near the neck, where there will be an incision, then to a central vein leading to the heart. The membrane of the port can be punctured more than 1,000 times without leakage. Chapter 2. Preparations and Setup. Nurse Vivica will now prepare the insertion of the needle. First, she cleans and disinfects her hands carefully. The SVP system is a central venous system which is more sensitive to infections than traditional peripheral venous system needles. It is therefore very important to maintain strict aseptic conditions. The nurse collects all the equipment that she will need: sterile gloves, 2 syringes, 10 milliliters each, a cannula, a Huber needle, a stopcock, isotonic saline solution, disinfectant solution, cleaning set, dressing material, which are gauze swabs wet with disinfectant solution, not just damp, Steri-Strip, highly permeable transparent film dressing, such as IV 3000 or Tegaderm. The nurse cleans the tray before she prepares the equipment. Make sure that you keep everything sterile. Nurse Vivica disinfects her hands again. Make the child feel comfortable before and during the procedure by talking to him or her and letting the child know what will happen. Remember to put on a protection coat before starting the procedure. It is important to remove the upper garments so you can clean the skin area properly. Allow the child to make decisions about things that don't affect the safety of the procedure. For instance, the nurse can ask the child if she wants to remove the EMLA patch herself, or if the nurse should do it, or maybe one of her parents. When the patch is taken off, Nurse Vivica wipes off the EMLA cream. Then she puts on the sterile gloves. She puts the different parts together and flushes the system with saline solution. The skin is cleaned several times, from the middle outward to an area that is larger than the IV 3000 or Tegaderm. The skin must be totally dry before you insert the needle. It should be air-dried for at least 30 seconds. The nurse locates the SVP under the skin and asks the patient if she's ready. The needle is inserted vertically through the skin and the membrane. Make sure that the needle is in the bottom of the chamber, but do not press too hard, as there may be an irregularity on the needle that can damage the septum and the skin when it is removed. The nurse checks the backflow and flushes slowly with 10 milliliters of saline. If it is hard to flush the line, do not use force. If totally occluded, contact the doctor. If there are no complications, she dresses the SVP. The needle may be needed to support it by a dry gauze swab. Do the dressing so you can clearly see the area around the needle. The nurse squeezes the dressing around the line to make it more movable. Chapter 3. Injections, Infusions, and Blood Samples. Now we're ready to use the SVP, and we will show you how to handle it. To take blood samples, start infusions, and give injections. Make sure that you have all equipment before you start the procedure. Disinfect your hands and use disposable gloves. If you don't change the cap after each procedure, put it on a sterile swab during the process. Clean the stopcock opening and hold a disinfected swab around it during the whole procedure. Start by flushing the line with 10 milliliters saline solution, 9 milligrams per milliliter. Draw the blood samples required. The first blood that comes can be contaminated and should be discarded. Before giving injections, you should start by flushing the line. Then give the prescribed injections. You should flush with saline solution between each drug. When finished, flush the line with at least 10 milliliters of saline solution. There should be no blood in the line. Start infusion if prescribed, or put the cap on. Pay attention that you keep the system closed at all times so that no air comes into it. Chapter 4. Daily Care. Things to remember for the daily care of the SVP. Inspect the skin around the needle daily to find early signs of infection. If the dressing is dirty or wet, it must be changed. The outermost stopcock should be changed every day if used. The needle should be changed every 10th day or according to local routines. In children with diapers, the stopcock may be contaminated with urine. Chapter 5. Removing the needle. Disinfect your hands. Use gloves. Flush with 10 milliliters of saline solution and 3 to 5 milliliters of heparin, 100 units per milliliter. Remove the dressing carefully. Put one finger on each side of the needle on the SVP to keep it in place. Remove the needle with the other hand. Chapter 6. Possible complications. When handling SVPs, you should be aware of complications that can occur. Bleeding, occlusion, thrombosis, air embolism, extravasation, catheter damage, infections. If any of these complications occur or are suspected, contact the doctor. The most common complication is an infection, which can be local or systemic. Local infections at the insertion site, around the catheter tunnel, in the skin over the SVP. The signs to look for are redness, tenderness, swelling, pus. Systemic infections. Microorganisms from the skin around the insertion site or contamination during manipulation can invade the blood. This can happen during the insertion of the SVP or during daily handling. Look for signs of septicemia. Interventions to minimize infections. Work under sterile conditions. This concerns surgeons when inserting the SVP and nurses when inserting the needle. Hand hygiene. Use aseptic techniques. Make daily inspections. Our skin is the most important defense for our bodies, and when you insert a needle through the skin, you endanger this defense. It is thus very important that only trained nurses have access to the SVP and that they maintain strict aseptic conditions. Remember that equipment and circumstances vary between countries. Follow local routines and use the equipment decided by your hospital. This video does not replace instructions from an experienced doctor or nurse at your hospital. Thank you for watching.